A randomized trial of low-cost mesh in groin hernia repair. Groin hernia definition. An inguinal hernia occurs when soft tissue, usually part of the membrane lining the abdominal cavity, omentum, or part of the intestine, protrudes through a weak point in the abdominal muscle. The resulting bulge can be painful, especially when you cut or lift a heavy object.
This month is Hernia Awareness Month, so today's Medical Minute will be on hernias. What are hernias, how common are they, and how do people get them? So hernias are when folks have a bulge, usually in men, but also in women. They have a bulge in their groin that may or may not be tender or painful. They're very common. Men in particular have approximately a 27% lifetime risk of having a hernia at some point. In women, it's much less common. About 3% or so of women get a hernia within their lifespan. Now, I'm talking about common hernias, what we call inguinal hernias. There are other types of hernias which we won't address today. In terms of what causes them, well, it often happens in folks who have weakened abdominal muscles for whatever reason and are doing some heavy straining. And this is part of the reason that it happens in young men more often than other individuals. Now, in men, without getting into too much physiology, men, of course, have testicles and a scrotum, and those structures descend through this canal, this inguinal canal. So the canal is much larger in men than in women, and that's part of the reason men are so much more susceptible or prone to having hernias. In terms of what we need to do about hernias, most of the time hernias don't cause problems. People can have them their entire life.
Application in medicine. The most effective method for repair of a groin hernia involves the use of a synthetic mesh, but this type of mesh is unaffordable for many patients in low and middle income countries. Sterilized mosquito mesh have been used as a lower cost alternative but have not been rigorously studied.
So hernia is a defect in your muscular wall that allows passage for the contents from inside your abdomen to protrude through that defect. You can get these defects from congenital defects. The most common area for this is actually in the inguinal region, which is down in the groin. And this is a defect that allows passage of anatomical structures in and out of your abdominal cavity. Most people will notice hernias first by either some an uncomfortable feeling or a bulge. A lot of times you'll have a bulge with no pain associated with it, but a lot of people will have some discomfort, usually at the end of the day, that is an aching type of a feeling that causes them to really notice it more after they've been active. Okay. And that's more notably in the groin. Anytime you stress that hernia, you may also have some discomfort with that. So whether it's at the belly button or in the groin or anywhere else, if you're pushing something into it, then that can be an issue for tenderness. So there's different ways to fix it. Usually we will fix these with mesh. We like to place the mesh, if we can, under the muscle wall. In the groin, there's two commonly used methods. One is an open, or called the Dünstchen method. And this method of repair opens the inguinal canal by making an incision over the top of the inguinal canal. And so we go down, open the canal up, and isolate the spermatic cord, and we place a piece of mesh on the floor of the inguinal canal so that we can reinforce that hole. So the other way to do this is laparoscopic. There's two different laparoscopic methods. The one that I use is called the total extraperitoneal method, and that is a method where we make an incision next to your belly button, and we come down underneath the rectus muscle and put a balloon between the abdominal wall and the abdominal cavity.
Methods. It was performed a double-blind, randomized controlled trial comparing low-cost mesh with commercial mesh, both lightweight, for the repair of a groin hernia in adult men in eastern Uganda who had primary, unilateral, and reducible groin hernias. Surgery was performed by 4 qualified surgeons. The primary outcome were hernia recurrence at 1 year and postoperative complication. Treatment. The hernia can be repaired by a surgeon pushing the lump back into the abdomen and covering it with a patch of mesh to hold it in place. There are two types of surgery for doing this. Open surgery, where the surgeon makes one cut into the groin in a procedure known as a Liechtenstein repair. Keyhole or laparoscopic surgery, where the surgeon makes several small cuts in and around your belly button to insert a camera to see the groin and surgical instrument to make the repair.
I'm James Harris. I'm a general surgeon practicing at Johns Hopkins, Howard County General Hospital. An inguinal hernia is a protrusion of abdominal contents into the inguinal or groin region. It could be either intra-abdominal fat or intestine that actually protrudes into the groin. It's most commonly seen in men, about 10 times more commonly than in women, and it's largely because of the groin anatomy. During development, when the testicles descend from the abdomen into the scrotum, that actually leaves an area where men are prone to developing a protrusion of abdominal contents into this region. About 1 in 4 men during their lifetime will actually develop a groin hernia. When someone has a hernia, they notice a bulge in their groin area. Sometimes this could be associated with pain. They could also have a experience of fullness in that area when they do heavy lifting, cough. Sometimes when they lay down, they notice that the bulge goes down, and then they get up and they start taking part in physical activity. They notice that the bulge gets bigger. Most of the time, people will experience symptoms, and that's the most common reason someone will come in for treatment of a hernia. If this is something that's detected on physical exam and it's not causing any problems, quite often you could just do watchful waiting and just follow a patient because of these types of incidental findings. But if it's causing symptoms, or if it's causing any increased bulge or pressure or any incidence of bowel obstruction, then those are situations where it needs to be repaired. I prevent people from taking part in any heavy lifting for about 6 weeks because the risk of recurrence is higher if you try to do any heavy lifting because it puts strain on the repair. But typically people are able to go back to work within the next couple of days. Usually they need to wait until they're off of pain medications before they are able to drive. But typically back to complete normal about 6 weeks. These hernias can recur. Certain people tend to be more prone to recurrence than others. People who are obese, smokers, they have lung disease, they have any kind of connective tissue disease, if they're on steroids, if they take part in heavy lifting, if they're weightlifters, these are things that could cause increased abdominal pressure and could cause more strain on the repair and lead to a recurrence.
Pros and cons. Pros. Keyhole surgery is less painful afterwards because the cuts are smaller and there is less muscle damage. Keyhole surgery has a faster recovery time in recurrent cases, where a hernia returns or if it is bilateral repair. In the other side, we have the open surgery. It has fewer risk of complications. Cons. In keyhole surgery, there is a greater risk the surgeon can accidentally damage the bowel.
After anesthesia, the surgeon will make a skin incision 5 inches in length in the groin above the area of the hernia. The surgeon will then dissect down through the muscle layers of the abdominal wall to gain access to the hernia site. The next incision dissects through the hernia defect in the inguinal canal and reveals the hernia and/or hernia sac, which is simply the peritoneum that lines the inside of the abdomen. The surgeon gently pushes the contents of the hernia sac back into the abdomen or dissects the contents free from the hernia sac and returns them back into the abdomen. The hernia sac is then closed with sutures. The hernia defect and inguinal canal are closed with sutures, and a piece of mesh patch is placed that is used to help reinforce the hernia defect. The defect or weakness in the muscle tissue needs to be repaired in order to reduce the risk of reoccurrence. Finally, the muscle layers and other tissues are sewn together, and the skin is closed with sutures.
Results. A total of 302 patients were included in the study. Hernia recurred in one patient, 0.7% assigned to the low-cost mesh, and no patients assigned to the commercial mesh. Postoperative complication occurs in 44 patients, 30.8% assigned to the low-cost mesh, and 44 patients, 29.7% assigned to the commercial mesh. Absolutely risk difference 1.0% percentage point. Conclusion. Rates of hernia, recurrence, and postoperative complication did not differ significantly between men undergoing hernia repair with low-cost mesh and those undergoing hernia repair with commercial mesh. The low-cost mesh have the same risk as the commercial mesh, so it can be a useful alternative for hernia repair in low and middle income countries. Thank you.